left one, I want your heel up on this roll of tape, so it's in a slight bit of flexion there, okay? So the MCL is at maximal stress in knee extension. We're going to take it in slight flexion so that when it goes back into extension, the tape's nice and tight, okay? Can I just hold that there? So, did not pre-measure, so it's too big or too small, I'm sorry. So I'm just going to do a locking tape. And again, when you do your locking tapes, just be quite light with the tape because you don't, sorry, thank you. Oh. That'll be too big for your leg. Because you're trying not to cut off the circulation. You just want to have an attachment point. In my practice, if I was doing this for someone just to walk around comfortably, I would do it without, but if they were hot and sweaty and I wanted it to stay on for sport, I would use we call it Tenso spray. It's a sticky spray just to help it stay on a little bit better. So your locking tapes obviously have to be above and below the length of the MCL. You don't want them to be too short or on the ends of the MCL. You want the tape to span where the MCL is going to be. I'm not going to just to save Vincent some tape, but I would normally, and I will use this one because I've already cut it, I would normally use Hyperfix because particularly with the medial knee, that skin's really quite sensitive there. And I will do some strips on the lateral side as well, but just to save Vincent the tape, I won't put it on the outside as well. But with the tape, just to cover the skin, it doesn't have to particularly go anywhere other than to cover where you're going to put the tape. I don't need any overlapping of this. If I had the 10 centimetre tape, I could just do one strip there as well. So that's essentially your scaffold for your tape, and I would have one laterally as well. So for the MCL tape, essentially you are literally recreating the MCL structure. So we're saying it's going from the medial femoral condyle down onto the tibia. So we want to reconstruct that. Overlapping and reinforcing through there. And then I will also do a little bit of a rotational strip. In both directions. Now, I would, just to balance the knee so we're not creating an abnormal pressure on one side that we're not got on the other side, I'll get you to I'm just doing much less, but some strips over the lateral collateral as well. Balance it. Okay. So if you want to, I'll just put that, so you put a locking tape on. Now I would use an elasticated tape normally. just so it's got a bit of give to allow for when you start moving around and the leg starts to get a bit warmer. So try not to reef the tape around so that you twist the muscles there. Okay, so if you'd like to do your modelling for everybody, so if you take your foot off the tape there and just sort of straighten your knee, can you feel a little bit tightish?
And on the inside.
Yeah. So you can do a model and turn around for everyone. So we don't want to cross over the back of the knee joint. It's uncomfortable and bulky and can be easily irritated. Now, if we were going to add a component, pop your foot back on there, of rotational control, then I would almost do like a relocation. So if we're thinking ACL, tibia moving forward, we're doing a relocation back, restraint if you like. So I'd come across through the back, up and around the other side. So starting down around the tibial tuberosity, posterior glide on the tibia, posterior glide across the back and around. And again, I might choose to do this one because you've got to go around the knee with a compressive tape as well. I know. It is, it's a lot of tape, isn't it? Just turn around with your back to me. So we're trying to avoid that really soft part of the knee at the back, but you can see you can't avoid it completely. You could try and maybe angle that one up a little bit more. If you try and extend your knee there, it feels tight through there. So it's quite a nice tape, solid tape to wear. It's not going to compensate for your ACL. It's just going to give you some feedback. But it does give a good medial support for your MCL. But again, if you get in an injury position, it's still going to stress while it's unstable. Okay? So, just show everybody, turn around here.
Do we do the same for the LCL?
Yes, yeah.
Just
You would do the
reinforce
opposite.
more
Yeah. So now I've got maximal reinforcement, just a sort of buddy reinforcement on this side. You just put more on the outside. There is a podcast on the sports map. I don't know if or How I Rehab. I think they've renamed it. A podcast out of Australia which has got How I Manage Isolated LCL. So that can be something if you're interested in that as a resource. So,
how long should it be on for?
the tape,
Yeah.
so it depends the why you're putting it on. So if I'm putting it on MCL tape to give someone a bit of fill-in protection after they've acutely damaged their knee, I would leave it on for as long as they could tolerate on their skin. That might be 5 days. But also in that scenario, I'd probably be getting them to get a brace because then they can just put on, off easy. Then you could be using this for sport. So if they're going back to sport, it might be it's on before the game, it's off.
After.
On before training, it's off. Okay. So, how about you all have a go at that?